personally, it's a very, very complicated answer. I think they should definitely be there as a last resort and probably for catastrophic health insurance. But I think, there's a question, well, should the government pay for health care? And if you say yes to that and think you've solved the problem, you haven't. Because the question becomes, well, how much health care should they pay for? Should they pay for the 80-year-old lady who's a vegetable to stay alive another 6 months? Should they pay for the liver transplant of the 40-year-old alcoholic? Should they pay for the operation on the guy who refused to wear his helmet in the motorcycle? Our resources are finite, and we need to do a much better job of figuring out where we spend them and where we don't. And right now, we make a lot of these decisions opaquely. If you're black and poor, chances are you're not going to get good health care. If you're rich and white, even if you didn't pay your insurance, chances are, you know somebody who knows somebody at Mount Sinai, so you're going to get a better cancer operation. You live in Iowa, and there's a certain operation that might cure you, but they offer it only in Seattle. You're probably not going to get that operation. And we're never going to have a world of equality of outcome, but we should at least have a world of equality of opportunity. But we shouldn't kid ourselves that every life is infinitely more valuable than anything else. We make trade-offs all the time. We don't feed children right in school. We destroy lives much earlier than when they show up in the hospital. And so the problem is we don't like to confront these decisions, just as you might not like to confront decisions that I mentioned earlier about your personal life. We as a society feel uncomfortable with explicit rules, yet those things get adjudicated all the time, just quietly.
So the last topic
and I didn't really answer your question, but I think at the day-to-day care, people should pay their own costs, but the real issue is how to design a system that incentivizes healthy behavior, because most of the healthcare costs in this country are due to either end of life or what is essentially the results of bad behavior. Heart disease, lung cancer, diabetes, they're not a sign that you've been bad, but they are aggravated by poor nutritional habits, lack of exercise, all these things. And if we could just get people to adopt much healthier lifestyles, our medical costs would go down. But I don't particularly want the government monitoring what people eat either. So the challenge is how to change social norms without brainwashing people. Let them understand their genetic information, educate them better at school. And I mean, really, the one that's, McDonald's has a huge role to play in this, just by what they offer people to eat. If the food companies could start promoting genuinely healthy food rather than kind of, truthiness, foodiness, where you put chemicals into something and claim that it's more healthy because it has some kind of one piece of nutrition. It's sort of like if you put please into something saying that it's polite, and the thing is still rude. So it's extremely complicated, and more information is a start. More information about the impact of the kind of food we eat, just as in the environment, more information about the impact of the kinds of things we drive or the stuff we use or the cost of air conditioning, that kind of thing.